To reduce your suffering in life, it can be useful to know the difference between love and limerence. Dr. Rachel Hannam is a psychologist at North Brisbane Psychologist. Rachel, what is limerence?
Well, limerence is actually a term that many people haven't heard of. Even a lot of psychologists haven't heard of this term, who I speak to. But it was a term coined in the 70s by a psychologist, Dorothy Tenov, whose research was in the area of love and romantic relationships. And she started and her book that she published was called On Love and Limerence. And she started to differentiate between love, which is, a sort of a pair bonding between two people where there's give and take and there's a healthy attachment, and people have moments where they feel happy and moments where they feel sad. And then this other thing she called limerence, which is characterized by much more extreme psychological experiences, not happy and sad, but sort of euphoric and dysphoric, sort of devastated. So it's this kind of obsessional love, this extreme infatuation that a person can have for a romantic object, another person who they desire. And our culture kind of romanticizes this. It's reinforced in movies and music and by Disney. And so we haven't really recognized that this actually can be a kind of addiction to a person and result in, suffering and quite dysfunctional behaviours.
What causes limerence?
Yeah, well, first of all, not everyone's prone to limerence. So there's a great story where Dorothy Tenov, who coined the term, was on a plane and she was describing limerence to the person sitting next to her, who said, "That's just ridiculous. Nobody feels like that. That's such a childish way of feeling about somebody." And she realised that there are people in the world not prone to limerence who'll never go through it. And then there are people who are very prone to it. And they tend to be very sensitive people, usually creative or intelligent, and, very prone to addiction of various kinds. So there's a proneness that exists in the person to begin with. So for someone to stimulate that limerent experience, there has to be something about them that is hard to sometimes put into words, but there'll be something about the limerent object, the other person, that just triggers the person's sort of addictive stuff. And then this whole altered mental state and neurochemical state starts to develop in the person's brain and body. So there's heightened adrenaline, there's heightened dopamine, the reward chemical of our brain, and there's heightened oxytocin, which is a brain chemical that helps us bond. And at first it's just a really nice sort of experience where there's a lot of fantasy and intrusive thoughts about the person. But sooner or later it can become quite obsessional, and it can kind of give the person a really hard time because their compulsive urges to connect with this other person can sort of take over their life to the detriment of other things in their life. So there's a whole chemistry to it in the brain.
Is there a chemical root to the problem as well? Like people low in serotonin are more likely to become limerent? Is there anything like that?
Yeah, well, we all do have different brains and, different levels of different neurotransmitters and hormones in our brains like serotonin, and it is associated with low serotonin when we're in this limerent state. So for some people, antidepressants can help them out a little bit with this struggle. And, some people's brains love dopamine. So if you've got a dopaminergic brain, you can be more prone to limerence as well. So, yeah, there are those individual differences.
It's such a vicious condition as well because as you get more infatuated with a person, you're more likely to push them away and become more infatuated. Is this a problem that people in limerence quite often suffer from?
Yeah, that's right, because it's such a roller coaster and there's so many ups and downs. They might push the person away because they realise they're too dependent and addicted to them. But on the other hand, they're craving any reinforcement, any bit of reward, any communication or any positive feedback from the person. And so one of the things that characterises limerence and is different to love is there's such an excessive need for reciprocity. They want this other person to feel the way they do. And if that doesn't seem to be happening, they can get quite angry and feel rejected or even abandoned by that person, and then it can turn into a much darker fantasy. And in the extreme, we can think of films like Fatal Attraction, where the character of Glenn Close becomes so obsessed with her male affair partner that she becomes very pathological in her behaviours towards him. And, we know how that ends, that film. But that's an extreme example. But, I've had clients who ended up becoming a bit stalkerish towards the object of their obsession, stalk them on the internet, kind of connected with their partner if they had a partner, or their exes. They really cross some boundaries, sometimes not in particularly destructive ways, but in ways that were not helping them.
That sounds like there's a dark side to limerence. That story you told at the start with the person on the aeroplane being so practical and no nonsense and not even being able to understand limerence. Is this a chance to bring in the idea of love languages that, a limerent person might send lots of flowers and perfume and gifts, and that's their infatuation style, but someone else might be more practical and no nonsense and show their love in other ways. So there is reciprocity there, but it's just not coming back to you in the same form that you're putting it out. Is that important for people to understand, that people express love differently?
Oh, people definitely express love differently, and the idea of the 5 love languages is a really neat little theory that has so much relevance and applicability in relationships, not just romantic relationships, but friendship and family relationships as well. The question being, how do I feel loved? But a person stuck in limerence feels loved usually by receiving words of affirmation. So communication becomes huge in limerence. Sometimes physical affection, if that's happening. Sometimes that's not even happening in limerence. I've met people who are limerent and obsessed with someone they've never met before. It's a really different thing to healthy love, because it's like we are all hardwired to bond with one another. But when that hardwiring of bonding behaviour and the desire to connect goes to an extreme, which is what limerence is, and we become obsessional, that's when it becomes problematic, and we're much more interested in getting rather than giving, taking rather than receiving. And so, the love languages, when it's going well, is about giving and receiving, knowing the other person's love language and loving them in the way that helps them feel cared for, and hopefully vice versa. But in limerence, the obsession becomes on getting reinforcement from that person, in the form that we want, whether it's gifts or words or whatever.
Yeah, that makes sense. There's an evolutionary reason for it, the bonding, but it just goes to the extreme, like you said, and becomes pathological. You're listening right now to Dr. Rachel Hannam, who's a psychologist with North Brisbane Psychologists, explaining limerence to us. Are there stages of limerence that you can maybe catch yourself in or catch someone else in to intervene?
Absolutely. Yeah, there's a few theories, but one common theory with limerence or obsessional love is that there are 3 stages. The infatuation stage, where we're just kind of getting to know the person, and they call it a glimmer. There's a glimmer that this person is special. Maybe people even think, I think this is my soulmate. But eventually that can that either dies away, it withers away like a flower, or it becomes a full-blown limerent experience, and we call that second stage crystallization. So with the crystallization stage, we're starting to get into full-blown obsession, a striking fear of loss, so the highs and the lows, the highs when we get the reinforcement, the lows if we don't hear from the person. And this uncertainty and the precarious nature of it heightens the anxiety. And if people stay in that crystallization phase, which they can for up to 2 or 3 years, which is quite painful for the person, eventually they'll enter the deterioration stage, because nobody's system can sustain this experience forever. And so the halo effect starts to wear off, and the person might get angry and start to think, look what you've cost me, you've cost me my relationship or my job or my mental health or something else. And so limerence starts to fade and to deteriorate, but it's not without its own carnage, because often there's anger or resentment or some damage done in the process. Hopefully not. Hopefully it deteriorates a little more peacefully than that, but it can go pretty sour.
Are people who were deprived of love as a child or suffered more trauma or anxiety more likely to become limerent as a way of attracting some more love back into their life?
Definitely. They are more likely. It's not necessarily a precondition, but we do find that people who've got a history of feeling rejected or abandoned, which is a kind of relational trauma, are more susceptible to limerence, because somewhere in their psyche they're still looking for that ultimate love and connection that they never got earlier in their life. However, not everybody who experiences limerence has a history of severe trauma. Some people are just prone in their personality, and a lot of the people I've worked with, they're really creative types. They're obsessional, yes, but obsessionality goes hand in hand sometimes with being an entrepreneur or, being being a good CEO.
Yeah.
So obsessionality is not all bad. It just depends on what the goal is that you apply it to. But when your goal is to get this other person to love you, then that can get you into some troubled waters. So personality plays a role, and a history of trauma can also play a role.
What are the treatments or responses is probably a better word to limerence? How should you handle it in yourself or in others?
Yeah, that is a really great question. I think the first thing, for a lot of my clients, it's been quite a revelation for them to know that there is a name for this. We know addiction to substances or behaviours like gambling, but people don't often know that this is another type of an addiction. So I would say if anyone's going through this, get on the internet and learn about limerence. Try to understand it so you can observe what your mind and your nervous system is doing. So understanding is the first step. There's some great websites. Livingwithlimerence.com is one of them. And there's some books on the topic which are written by neuroscientists who can really explain to you what's happening in the brain. So understanding is the first step. And what you will come to understand is this is goal-directed, goal-oriented behaviour gone to the extreme. So finding different goals, finding ways to channel all of that obsessional energy into something more fruitful, something more productive, is one way to handle it. So purposeful living, find a different purpose. Throw yourself into something else as much as you possibly can. And I would say, seek out the support of a good therapist or coach to help you get through it is another good step to take.
You also mentioned the influence of our songs and music, which is all about, I can't live without you. How am I going to continue without you? What should we do about our pop culture and the way we consume it?
Well, luckily this understanding of limerence, particularly from a neuroscientific point of view, is starting to get a little bit of media and a little bit of attention. It's only taken 20 years, but that's how it works in psychology.
Yeah.
You can't change the culture, but I would say anyone who loves love, there are those love junkies out there, and definitely music and culture and film, thrive off the emotional torrent of the euphoria and exhilaration of romantic love. But try and see those books and movies and songs a bit like an action film. You don't go and watch Mission Impossible and think that can be your life.
Right.
It sells tickets and magazines, but it isn't real life. And so we need to keep a perspective that the romanticism that pervades so much of our media and popular culture is not grounded in reality, just like those action films aren't grounded in reality. Enjoy them, but keep that perspective that this is not how healthy long-term relationships go. Remember that our brains can be dumb. Brains can be really smart and brains can be really dumb. And we're all enculturated, so we're all easily seduced into, delusion. It's not just patients with paranoid schizophrenia who are prone to delusion. That's just an extreme, but all of us are prone to thinking that's a bit delusional, that's not grounded in reality. So brains can be dumb. There's no shame in that. Learn about how brains work and get into your own psychology in order to, have a healthy relationship with the stuff in the culture and even with your own thoughts, because reality and thoughts about reality are different.
I think that's a good point. Sometimes we go to see a GP when things are broken and there's a disease there to sort out. But psychology is a bit different to a GP, that these problems are not just in sick people, they're in all of us, and we just have to manage the extremity.
Exactly. Yeah, you go to the doctor with a broken leg and the doctor says, okay, 6 weeks, it should be healed. And that's, a fairly black and white situation. But so many of our struggles, like limerence, in the realm of mental and emotional health, they're not as black and white and clear-cut as that. It's often 2 steps forward, 1 step back, and it can take a long time. So I would also say to people, be kind to yourself, be patient with the process. Your brain's not going to give up, its reward systems easily. It's going to take a fair bit of work for you to reshape and rewire your brain. But keep going. You can do it.
Psychologist from North Brisbane Psychologist there, Dr. Rachel Hannam. Rachel, thanks for your time today.
Thank you so much for having me, Ashwin.